This is a special podcast presentation from 700WLW.com. This is Doc Thompson On Demand.
Political debates, legal debates, protest rallies. Expect to see that all today, maybe over the next couple of days. Downtown Cincinnati. That'll be going all over the country, but certainly in Cincinnati as the Sixth Circuit Court of Appeals is set to hear arguments on the latest challenge to Obamacare. And of course, the central tenet around that is the personal mandate, the individual mandate. Should the federal government be able to require you to purchase something? I say no. Ron Pollock joins me now. He is the founding executive director of Families USA. How are you, Ron?
I'm doing well, Doc. Good to talk to you.
Thank you. What is Families USA?
Families USA has been around almost 30 years. We're the national organization for healthcare consumers. Our goal is to achieve high-quality, affordable health coverage for everybody.
And you think Obamacare does that or comes close to doing that?
Well, I think it's a step in the right direction. There's no legislation, obviously, is ever perfect, but I think it's a big step in the right direction. You know, there are lots of people actually gaining the benefits right now. You've got children, if they've got a pre-existing condition, insurance companies are prohibited from denying health coverage to them due to that pre-existing condition. Young adults are now able to stay on their parents' policy up to their 26th birthday. Small business owners are now getting tax credit subsidies to make health coverage more affordable for their workers. Seniors who have this big coverage gap in their prescription drugs, this so-called donut hole, they're now getting a 50% discount when they're in that donut hole, and that coverage gap is going to be eliminated. So you've got people in all sectors of society that are already gaining benefits from this, and so it's a step in the right direction, but we're still going to have to make further improvements in the health system.
So what are the further improvements if this is just the beginning? Where would you like to see this thing go?
Well, one of the things that the legislation does, but it only gets implemented in 2014, is that those people who are typically middle-class people who can't afford health care coverage, they are going to get tax credit subsidies to make coverage more affordable. It goes to people up to 400% of the federal poverty level. So you would get a tax credit subsidy, reduces your taxes, to make coverage more affordable. And 400% of poverty for a family of four goes up to $89,000. The lower your income in that income scale, the higher your tax credit. So one of the things we're going to have to look at is how well does this actually serve to make health coverage affordable? And perhaps we'll have to make adjustments further down the line, but that people will get a significant tax cut in order to pay for their health insurance premiums. That's a big deal.
Do you favor a single payer system where the government just simply provides health care for all?
I don't think that's what we in the United States are going to do. I think we want...
No. Do you favor that, though?
Not in particular. I really think what's most important is that everybody have access to affordable coverage, whether it's private insurance or public coverage. I think the public side of it should be a safety net program like we have for seniors who couldn't get insurance before from private insurance companies, and lower income people who can't afford it. But I think having private insurance is fine as long as that private insurance provides decent services at a decent price.
But see, we all already have access to health insurance.
Yeah, except it's not affordable for many people. As you know,
but that is access, though.
Well, it's not meaningful access if you can't pay for it, of course, and the whole idea of the Affordable Care Act is to try to make it more affordable for people, and hopefully tens of millions of people who feel priced out of health coverage are going to be able to get it. That's what the assumption is.
So the key is making it affordable, but see, I don't see that happening here. If you look at health care around the world where government is more involved, whether it's Canada, England, it is not affordable. They are forced to limit the amount of health care, ration it one way or another. And people made fun of people like Sarah Palin for saying death panels, but essentially it is. They are going to have to limit, not all of us, Ron, under any type of government plan or even our own personal insurance, can get unlimited surgeries or health care. There are limits to it.
Of course. Well, but right now, we've got literally tens of millions of people, according to the Census Bureau, over 50 million people who have nothing. They just don't have any insurance coverage whatsoever because they can't afford it. And I think what we're going to see is that as people get these tax credit subsidies, more people will be able to afford coverage who couldn't afford it before. And by the way, the other thing that the Affordable Care Act does is after you buy insurance, as you know, you still have to pay deductibles and co-payments, and sometimes those things aren't affordable. The Affordable Care Act does provide limits on what people have to pay out of pocket, and it does it on a sliding scale so that people who can't afford even relatively modest amounts, they will be protected. Those who can afford more will be able to get protection, but not quite the same protection.
All right, so if we are essentially providing health care for everybody, it is make sure that we take from some people and give to others who cannot afford it. That's the basic idea here.
No, I don't. I don't want to see that happen, and certainly that's not what the Affordable Care Act does. What it does do is it tries to create greater efficiencies in our health system, and as you know, there are enormous waste in our health system.
Sure.
And so we try to get that squeezed out. The drug companies had to pay $80 billion in rebates because they're paid too much. The insurance companies are not getting windfall payments under Medicare, and that results in about $130 billion in savings to taxpayers. The hospitals are getting paid based on quantity of services rather than quality of care, and they're going to have to give up about $150 billion in a payment what they would otherwise receive. So we are creating efficiencies in the system, and that efficiency allows us to pay for these tax credit subsidies that will make health coverage more affordable.
Ron, I'm all about efficiencies. I think that should be the cornerstone of everything, certainly government. But when you create dozens and dozens of new agencies and new levels of bureaucracy, that is not going to be efficient. But here's my question. Why can't we allow the free market to provide health care for those who choose to buy it, and even affordable health care? Why can't we allow the free market to do that?
Well, we've tried that. We have 50 million people in the United States.
See, that's the problem.
Who can't afford health coverage.
No, we haven't allowed the free market to do it. Not in a very long time.
Well,
you think it's been free market over the last 20 years?
Oh, absolutely.
No, it has. Ron, when you don't allow me to buy insurance where I want, and you have different restrictions on insurance companies on what they can do, who they can sell to, and then the government pays them Medicare and Medicaid, where I don't even see how much the operation is until afterwards, or the prescription, that's not the free market. If you take the restrictions off of the insurance companies, they will provide a free market solution to it.
Well, Doc, in 1965, when Medicare, because you referred to Medicare and Medicaid, those are our big government health programs. In 1965, before Medicare and Medicaid were enacted, more than half of America's seniors could not get health coverage. You know why? Because the insurance companies didn't want to sell insurance to seniors because they thought they were most likely to make claims. They were more likely to be sick. They were more likely to have chronic conditions. And so the insurance companies, and this is a totally free market at that time. There was no Medicare. There was no Medicaid. There was no government health coverage. And over half of America's seniors didn't have health coverage. Medicare came along.
But you make an assumption that they didn't have it because they didn't want it.
No,
please. Or because they couldn't afford it, but they wanted it.
Yeah, please, senior citizens, as you know, they really feel they do need health.
No.
Coverage.
50 years ago, 60 years ago, I don't know what senior citizens were wanting. Were you a senior citizen back then? Are there studies to show whether or not they wanted it and just couldn't afford it?
I don't know whether there are any studies, but I think we know enough from human nature that when you're old and you're more likely to have health care conditions, have chronic health problems, you're going to want them to be taken care of. And if you can't get any coverage,
you're making the assumption
that
they could not afford it, that they went out and said, I just simply can't afford these things.
Well, that's right. They couldn't afford it, and insurance companies wouldn't sell to many of them. You know, you still have these policies that say if you've got a pre-existing condition, if you've got asthma, you've got diabetes, you've got high blood pressure, we're not going to sell insurance.
So you think the government should also mandate that we all buy, and for those of us that cannot afford it, buy life insurance as well?
Well, Doc, let me.
Do you think they should mandate, and for those of us who cannot afford it, provide life insurance as well?
Let me explain how, because you're asking the question that the court's going to be dealing with.
No, I'm asking you
I'm
asking you based on.
I'm going to answer your question.
Should they mandate that we buy health or life insurance?
No, I don't.
What's the difference?
I don't think so. So I'm going to explain it. I hope you give me the chance.
Yes. What's the difference then?
If you have health insurance and I don't, and I get into a car accident, I'm going to wind up going to the hospital. I'm going to get care. And you know who's going to pay for my care? You are. You're going to pay for my care because the hospital has got to make up for the cost of covering and caring for me. They're going to add to your bill, and your premiums are going to go up. And so right now, if you don't have an individual requirement that people can afford health insurance, purchase it, they are in effect foisting their bills on somebody else. I think that's unfair.
So because we have said that hospitals cannot deny people, we started with one bad law, we have to build another one on top of it. Why don't we simply say, you're not getting it if you don't have coverage? If you're not smart enough to do that and you get in an accident, that's your fault.
Well, we can do that. That's not the society I want to live in.
Well, there you go.
I don't want to live in a society
don't try to build off of one bad law and say because you've created one bad system, we're going to have another one. That's not a justification for it. You still didn't answer my question. Should they mandate life insurance?
No, I don't think they should mandate life insurance. I don't care.
Why not? If you die, wait a minute, Ron. Wait, hold on. Let me make my point about life insurance. You have stuck to the fact that health insurance is something we all need. If you die, somebody has to pay for your funerals, right? Someone has to pay for your embalming or your cremation or whatever. And if you don't have it, who's going to pay for that? We're going to pick up the slack somewhere else. So shouldn't they mandate that as well?
I don't think we should mandate a whole bunch of things. Health insurance is very different. Even if we didn't have a federal law that said if somebody's at immediate risk of life or limb, that they need to be treated by a hospital. Even if we didn't have that federal law, under common law, which was not something, that is passed by statute, we essentially had a tradition that if somebody's at immediate risk of life or limb, they are to be treated. And that's a kind of society I think we would like to have. And
wouldn't you like to have a society where we take care of people when they die?
Ultimately, the cost of that is going to be borne by somebody who did purchase health insurance. And by the way, the average premium for family health coverage rose by more than $1,000 to pay for the uncompensated health care costs of the uninsured.
What about the people who die and we have to bury them and we are also paying for that? Do we just lay bodies on the side of the street? No, we have rules. You have to take care of those things. We can't just lay bodies out there.
The cost of that are much less expensive.
Doesn't matter. It's thousands of dollars for every body that dies.
No.
So it's all about the amount. If it was a lot less in our healthcare system, you'd be okay with it.
No, and with health, I think we as a nation have made a commitment to protect people at a point when they're at most risk of losing their life.
So after they've lost it, it's okay. The hell with their family who's grieving in that. They're not. We haven't made that commitment.
Well, then the family will pick up the cost of burying that person.
What if they're poor? What if they're the same people who can't afford health insurance?
Well, it's you can get funerals at a much lesser expense than it is to get even a single day.
Thousands of dollars. You don't have that. People don't have that.
No, that's not quite true, Doc.
No, that is absolutely true. Do you know what the average funeral is? Now, if you're talking the state taking care of it.
But if you want a simple funeral, it's really a whole lot cheaper. But in any event, I do not want to foist the cost of health care to keep somebody alive on those people who have purchased insurance. And so those people who can't afford it,
sounds nice.
I think should be able to
get
it.
That sounds nice, but that's your selling point. We don't have to provide for people that do not have, and we do not have to say we are going to take care of you if you're in the hospital. You may want to live in that as a society where we do that, but you also may want to live in a society with a lot of other stuff. And before you say we of a nation has made that commitment, I have not made that commitment. There's a lot of people like me out there that simply want some personal responsibility.
Well, and part of personal responsibility is to make sure you pay your bills, and if you get health care, you should pay for it. And if you don't have insurance, you're likely to be unable to pay for it because the cost of health care is very substantial. And you never know when you're going to need health care. You may all of a sudden have appendicitis. You may have a heart attack. Those costs are very high. If you don't have insurance, you're probably going to be unable to pay for the bill. And individual responsibility means you should pay your bills rather than foist them onto someone else.
Yeah, that's true. And if you do not have health insurance, they won't be foisted on somebody else if we don't provide that coverage when you go to the hospital. We simply say, Ron, you should have been smart and did this. I'm sorry. Your family, you got anyone who wants to pay for you here? Okay, then have yourself a nice day. You should have bought it years ago.
Well, thankfully, we're going to be making health care coverage much more affordable under the Affordable Care Act, and those people
well, actually, the verdict is still out on that, by the way.
Priced out of the care in the past and who are uninsured, those people are going to have access to more affordable coverage. And small businesses now are going to get help so that they're in a better position to cover their employees. Most small business owners do want to provide coverage, but they can't afford it. Now they're going to get help doing so.
It's Ron Pollock from Families USA. I appreciate you joining me. What I'll do is I'll put a link to your information on my blog at 700WLW.com.
Good to talk to you.
Thank you, sir. I appreciate it. See, the problem is there really hasn't been a free market in a real long time, and it could provide for it. By putting these mandates out there, all we're going to end up doing is creating a system that is not good, and the alternative is going to be 5-10 years down the road when they realize how broken this is, because it will not have the miraculous effect that they are predicting. 5, 15, 10, whatever years down the road, they will say, it's broken. What we need is greater control and more government. The government just needs to take care of all of it. Won't that simplify it? That will be the argument that is made. Allow the free market to do it, and it will do it. Going to be a lot of protests and rallies, by the way. If you want to have your voice heard, I'm sure you can find one. The Cincinnati Tea Party is planning a gathering at Fountain Square to get signatures against Obamacare. And then they'll have a rally in support of the plaintiffs outside the federal courthouse. The pre-event petitioning, if you want to take part, sign it, or help them out, will be Fountain Square 11:30 to 1 today. And then they'll rally outside the courthouse 1 to 2 p.m. That is the Porter Stewart U.S. Courthouse at 100 East 5th Street today. I'm absolutely opposed to the mandate. How can you mandate that somebody purchase something? How does the federal government say you must take part in commerce? They know it's wrong. Even the people that support this. But they have to come up with the excuses and the reasons why it is constitutional so they can continue with the agenda. Because their agenda is more important than what's right. Certainly what's more important than America. In Coleraine, Jeff, you're on 700 WLW.
Hey, Doc, 2 points. One on your health or your life insurance. If you have kids, who's going to pay for them as they grow up if you die?
That's right. Unless you have that life insurance or something to take care of them, guess what? Right. They're going to be, wards of somebody else. Someone else going to have to take care of them.
And then point two, how many people are sitting at bars on the weekend blowing $100 in alcohol who sit there and boo-hoo about they don't have money for health insurance?
That brings up a great email that I just got, Jeff. It's from Kim. She said, this man is crazy. How many of the people who claim they cannot afford insurance have cell phones, TVs, high-speed internet, buy beer, cigarettes, eat out, party, and etc.? That's the whole point. I'm sure there are some of them that aren't doing those things and can't afford. I'm sure that exists, but there's a lot that are. And if you really want to cover it, allow people to make their own choices. You want to sit on the bar stool, you want to drink it up, you want a big screen TV as opposed to health insurance because you can't afford both, that's your choice. But don't say simply because we have been bleeding hearts in the past that say you absolutely will get coverage. We will take care of you. If you have a threat to life and limb, we will give you medical attention. Because we've said that, and created a bad system. Now we're going to build on that bad system. Maybe we go back and address it from the beginning and say personal responsibility. Buy insurance, so if something like that happens, guess what? You'll get treated. If not, I'm sorry. Doc Thompson, 700 WLW. 700 WLW and Matthew 25 Ministries, teaming up with Grill and Partners of John Morrell Grippos and 7-Up as we offer free lunches today, 11 to 1. All you have to do is drive through Matthew 25's location on Kenwood and Blue Ash as we thank the community for support, and we continue to support earthquake, tornado, and other disaster victims around the world. I'll be out there after I get off the air at about noon. I'll be out there about 12:30 or so. Mo's going to be out there, Willie, Seg, Yid, all kinds of people out there. Please stop by and say hey. And an email, Doc, everyone argues over insurance as a method to lower cost of health care. Tell me that the healthcare community doesn't confuse the issue. Free market insurance, fine, whatever. I'm sure that would lower insurance costs. But what about the drug industry? Record profits, yet shortage of pills, supply and demand. They can justify higher drug costs because of shortages. Well, you're right, Curtis. You bring up a good point. That's one of the big costs of medicine. The problem is, that's not really free either, because you and I subsidize them to develop products. Then they sell them cheaper around the world. You can get some of the same medicine in other countries much cheaper, even though our tax dollars went to develop some of those drugs. That's the reason it needs to be free. It's not just the government mandating that we do stuff or trying to control stuff like that. It's also helping out the quote-unquote private industry with our tax dollars that we don't see the benefit from. Leave it alone. People will develop medicines on their own, and they will do it for profit and make money. And then somebody else will come out and say, if they came out with a impotence drug, maybe I can too, and find a cheaper way to produce it. That's how it works. When's the last time you went into the doctor's office and actually found out how much, as you were going in, or even after you were there, your visit was? Is there a big tote board on the wall that says doctor's visits $50 or $100 or $500? No, we don't even know that anymore. Let the doctors post their rates. Hey, you want to come in for an office visit? It's going to be $100 or whatever. Okay, here you go. I'll pay it. It's pretty simple. One of the flaws with health insurance is that it's tied to our employers. We went down that road years ago. People start accepting that that's how it should be done. No. Shouldn't have anything to do with it unless your company wants to provide that as a benefit where they say, we'll go ahead and take care of your costs, much like they will buy housing for some people. You know, if you're one of those CEOs, or sometimes they'll say, we'll go ahead and take care of your mortgage or your interest or moving expenses. But it should be done privately and not tied to it. It shouldn't be tied to one location either. Get some calls, but for 71 North and 275, a big pile up right under the bridge. 3 cars there, 71 North and 275, a big pile up right under the bridge. At least 3 cars involved. Try to avoid that area if you can. Let's go to Paris in Springfield Township. How are you, Paris?
Doc, how are you doing today?
I'm doing fine, sir.
Listen, I have a feeling that people have short memories. The state of Massachusetts and Hawaii tried Obamacare, and it didn't make it for 8 months. It went broke.
Hawaii's was specifically targeted at the kids to try to help the kids out. Theirs, it didn't even make it a year, and they ran out of money.
And so did the state of Massachusetts.
Mm-hmm.
And my point is, today we have too many people living on freebies. And I see it every day when I go to the grocery store. Now, Cincinnati Bell is coming out for the poor. They want to give them 250 minutes of free phone time, almost a phone for nothing. And people like you and I and the people out there, it's worked, played by the rules, paid our bills. Now we're going to subsidize this. I think it's wrong, Doc.
Well, you know what? And that's been going on for a while with the free phones, Paris. That has happened. But when it looks nice for a company like Cincinnati Bell or whoever else that says, and I've said this about Duke and other utilities where they're like, hey, we're going to take care of those people. Subsidize it. The company helps them out, gives them a break on their electricity or their phone or whatever else. The company is not giving them the break on that. You and I are. The company is not doing with less of a profit or going to their investors saying, you know what, we're going to go ahead and do with 10% less or 4% so we can help the homeless or the poor. No, they're simply charging you and I more. They pass along that to us. So aside from the government doing, when you hear a company being very benevolent and giving money out and very caring, altruistic, they're still making their profit margin. You and I are still paying for that if you're using their products. So while it's nice and it's good company imaging to say, we are going to go ahead and donate money and we're going to go ahead and provide this, they're not cutting into their profit margin. It's different if you see an executive in the company say, I will provide this amount of money from my checking account. That's a little bit different. We set up a pattern, though, by providing this stuff where people like you and I start saying, why am I beating myself up? Why am I the fool that's actually putting all the time and effort into it? I'm working, and I have quite often less than other people that aren't. So why am I the fool? Maybe I should just go ahead and throw in the towel. If you can't beat them, join them. And I think that's where we're at right now. New numbers out, more Americans on food stamps and welfare than ever before in American history. More than ever before. Yeah, the economy's bad. Economy's been bad before. I think we got to a point where people said, why am I working so hard? Why am I the fool? And eventually they just stop. We've trained the culture to not work and not care about it, to just accept it. Just accept it and take what the government's going to hand out to you. And we're going to continue with that. We started with the idea that we're going to go ahead and during emergency situations provide medical attention for anybody who needs it. Sounds nice. Sounds very caring. We should do something like that. Very emotional. But then you see that's used to, well, because we provide that, some people are making you pay more. Do you really think Ron Pollock that was on really cares about people paying their own way? That's what he's using. Well, they're costing you and I more because they go in and get free medical anyway. Do you think he's worried about the people on welfare that are costing me more money? Or all of these other social programs? No. They're simply using a bad idea to build on it. So what's the next bad idea? You know what else is costing us more money? If we have a mandate for health insurance and the government is paying for a lot of people, you know what's costing us money? Those people who are fat. Yeah, they're costing us a lot. Obesity, you see it out there. Obesity, all kinds of health risks tied to obesity. So let's make sure those people aren't fat. So we have to make sure they don't eat certain foods. No, not tell them what they can buy on food stamps. That would just be offensive. What we'll do is just mandate that, well, Twinkies can't exist anymore. Get rid of trans fats and salt. We've already seen that. And why not mandate that everybody has to exercise every morning? We'll tie it to your work. Wherever you go to work or in your community, you've got to roll out for 7 a.m. roll call and take part in calisthenics. Why? Because it's going to cost us more because of the Obamacare. We're going to have to do that. What other bad laws will come about because of it? Justifying bad laws because of previous bad laws or policy. It's a very bad way to go. Doc Thompson, 700 WLW. Well, it's certainly going to cost us all a lot of money if you get a brain tumor. Well, under this grand idea that we're not going to turn anybody away, and we all have to pay for it because that's the society I want to live in. If you get a brain tumor, it's going to cost us all a lot of money, right? So I can only imagine the next government mandate is to ban cell phones. New report out today says that cell phones could be a carcinogen. Yep. This came out in France. It's the International Agency for Research on Cancer. It's kind of the cancer agency of the World Health Organization. Now, they didn't do any new studies. They simply looked at a bunch of other studies, and they made an assessment. It's now going to go to the official World Health Organization panel, not just this one cancer wing of it. And they say that your cell phone could cause cancer. They found that there is no clear link between the cell phone and cancer, but they said it shows a hint of a possible link between very heavy phone use and a rare but often deadly form of brain cancer. It shows a hint of a possible link. between very heavy phone use and a brain tumor. So I guess that's what's next. Some people claim it's a carcinogen. We don't want to have to pay for everybody, so let's just go ahead and ban them all together. I think that's probably the way to go. Carl, Pleasant Ridge, you're on the big one.
Hi, Doc. Long time, first time.
Thank you, sir.
Great topic. I don't buy the argument of your guest. I just received my annual health insurance rate increase, and it was 24% for a stripped-down policy. People are still getting drastic rate increases, and the insurance company can't tell me if this rate increase is based on my age or due to increased cost. Some of the things that the Republicans have been discussing and proposing won't work. They keep talking about allowing insurance companies to sell insurance across state lines. The reason why insurance is less expensive in some states is because the cost of care is less. Insurance rates vary from county to county in Ohio. It's cheaper to have surgery in Cincinnati than it is in Cleveland. People in Cleveland pay more for their insurance. Another thing that has been discussed is tort reform. They tried that in California years ago, and they tried it in France, and it didn't work. We do take care of the poor in this country. It's called Medicaid. I agree the system's broken, and it just seems to be getting worse.
I think one of the things we have to remember, Carl, is and this is the reason I brought up the whole free market thing. There was a case of a doctor in New York City about a year and a half ago that wanted to simply do away with dealing with the government and Medicare and Medicaid. He got tired of all the forms and everything. He said he's paying people to just process all of these forms, and I think you realize if you've ever had a claim go through how ridiculous it is. If you've ever gone to surgery, you get forms and bills from doctors you never even heard of, people you didn't know were involved in your care. You know, they charge you $5,000, $21, $178. They just keep coming in. Then the insurance company files it, and they send you more bills, and you're only responsible for 9% of it. And this one has an outstanding balance of $53, and it just keeps coming in. So this doctor said, you know what? I'm not dealing with that anymore. I'm going to simplify my billing. He simply came up with a plan that would say you would have unlimited access to him, as many office visits as you want over the course of a month, and I think he wanted to charge $75 a month. $75 a month. You could come in as much as you wanted. I don't know if he had some sort of limit, like you couldn't be there, 400 times a month, but I think it was basically unlimited. $75 a month. It's a pretty good deal. I'd do that. I might do that. It's a heck of a lot smaller than what I'm paying now. They wouldn't let him do it. Illegal under New York law. Why isn't something like that possible? That's exactly what we need. That's what the free market would provide. I've got a solution how to simplify it and make it cheaper. What we really need is to go back to the attitude that health insurance is for catastrophic situations. It is insurance that if the bottom falls out, you're not going to have the bottom fall out of all of your finances. You're not going to lose your house. Now, health insurance, it's not health insurance, it's a maintenance plan. It's when you go in and buy a DVD player and they say, hey, you want to pay almost double for that thing, but if it breaks, we'll fix it. That's what you and I are doing. We don't need that. How often would you go to the doctor normally? I might go a couple of times a year. So what's that cost? $50? $200? Fine, I'll pay it. Just give me a low premium, $50 a month. I'm only in my early 40s. No health issues that I know of. So give me a low premium, $40 a month, $20 a month, whatever it is, that in case I have something horrific happen to me, I'm not going to be charged $10 billion and I lose everything I have. We go back to the attitude that it's catastrophic and we tear down those restrictions and allow the free market to work. But you know what? I think the president may have another good idea. Yep, he and the First Lady, his administration, they have come up with an idea that will really lower our health care costs, and I'm going to share it with you next on 700 WLW. Willie claims that he's going to be at Matthew 25 Ministries at 11 handing out free lunches. He claims that. You can check for yourself. I definitely will be there afternoon. It's Matthew 25 Ministries in Blue Ash on Kenwood. Stop by today from 11 to 1. Again, Willie claiming that he'll be there at 11. Do I sound skeptical about that? We shall see. We shall see. President has an idea. His administration has launched an incredible earth-shattering, brand-new, unique idea that's going to lower all of our healthcare costs. He's going to try to lower the obesity rates in the country. His administration is ditching that food pyramid remember that food pyramid graph we all grew up with? They're getting rid of that, and that's going to help lower the obesity rates because we're all going to be eating healthier now. Do you remember the food pyramid? Little pyramid. Actually, it was a triangle. It wasn't even a pyramid. Triangle, the food triangle. And at the bottom of it, you'd have, grains. And then you'd have the next level up would be split. It'd have milk and dairy and meat and then fruits and vegetables. Well, they're doing away with it. And they're replacing it, and this will be unveiled officially tomorrow. They're replacing it with a plate-shaped symbol. Yeah, it's a plate-shaped symbol. It's going to be sectioned off into 4 colors, one for fruits, one's for vegetables, one's for grains and proteins. There it is. That's going to get us back on track. You don't think that's going to do it by itself? Did you notice anything else about that? The 4 colored sections, fruits, vegetables, grains, and protein. Where's the dairy? The dairy is going to have its own separate little circle off to the side of the plate for dairy. What do you call a circle graph? If you do a graph, you do one with bars, you call it a bar graph, whatever. What do you call it? Don't you call it a pie graph or a pie chart? They're calling it a plate graph or a plate chart. They created a pie chart that says don't eat pie. Here's a pie chart. Oh, wait a minute. We can't call it a pie chart. What else can we do? Make it a plate. But all the little pieces are wedge-shaped like pieces of pie. No. It is a plate chart. They created a pie graph that says don't eat pie and then realized that's probably not the best symbol for it. But rather than give it up, no, it's a plate, and then we'll put the milk off to the side. See how that is? They also have another piece of the puzzle. They are also going to instruct Americans, eat less. That's their big eat less. According to Margot Wooten, she's the director of nutrition policy at the Center for Science and Public Interest, she said for them to have said eat less is really new. She said we should have been saying eat less for a decade. So that's the big plan. Apparently, if you eat less, you're probably going to weigh less. In fact, on their website, they list 3 common causes for you gaining weight. Are you ready? Number 1, excessive caloric intake. Number 2, thyroid disorders. And 3, a lack of physical activity. These things could cause you to lose weight. I'm wondering if we can get some sort of class action lawsuit together. Be able to sue the federal government. Had they only told us eat less 30 years ago, we'd all be thinner. Mulligan stew and the food pyramid, if they had told us to eat less years ago. Now they're on track, though. Be happy to know that their pie chart that says don't eat pie is going to do the trick. It's Doc Thompson on the home of the Reds, 700 WL.